Caroline, you can start if you want to unmute yourself.
Thank you, Laura. Hello, everyone. I'm just going to bring my speaking notes over into my screen so I can get us welcomed and introduce tonight's presenters. So welcome to tonight's AECEA Connect. I'm Carolyn Parks, Vice Chair of AECEA's Board of Directors, and thank you for joining us. I'm going to begin tonight with a land acknowledgement. We acknowledge that what we call Alberta is the traditional and ancestral territory of many peoples, presently subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, Kainai, Piikani, Siksika, and Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and the Tsuut'ina Nation, and the Métis people of Alberta. This includes the Métis settlements and 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today, and those who have gone before us. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. Before we begin tonight, I have a few housekeeping notes. This evening, we will be recording the session and we'll make it available on the AECEA website at a later date. We are using the GoToMeeting platform, and so all participants will be muted throughout the presentation, but if you have questions, please put them in the chat box, and at the end of our presentation, we'll have a moderated discussion and address any questions that you have. A quick reminder, AECEA is a member-based organization, and the ability to do our work is dependent on our membership. If you're not already a member, you can become one by going to aecea.ca/membership. And to our members, thank you for joining tonight and thank you for your membership. All right, as you likely know and why we're all here tonight, as of April 1st, 2025, Alberta families lost access to subsidized funding for early learning and childcare costs. Simultaneous implementation of a flat rate parent fee of $15 a day or $326.25 per month, plus permission for providers to charge optional supplemental fees occurred. With this tremendous shift in policy and practice, questions and concerns emerged. Questions such as, how will this affect lower income families for whom this flat rate may not be affordable? In partnership, AECEA and Alberta's Early Learning and Care Leaders Caucus, sometimes referred to as ALC, and the Muttart Foundation set out to learn more about the effects of this change on families. We learned from families themselves and from programs. Tonight's presentation is a summary of what was shared with us, and it includes policy recommendations to support childcare affordability. Before I pass it over to tonight's presenters, I want to express AECEA's thanks towards our partners, ALC and the Muttart Foundation. We appreciate the opportunities to work together on projects that consider and care for the children, families, and early childhood educators of Alberta. Now, let me introduce tonight's presenters. Christopher Smith is the Associate Executive Director for the Muttart Foundation, a private charitable foundation based in Edmonton. He has lead responsibility for the foundation's work in early childhood education and care. In support of his work at the foundation, Christopher serves on the steering committee for the Community University Partnership for the Study of Children, Youth, and Families at the University of Alberta. In fall 2022, he was appointed to the National Advisory Council on Early Learning and Childcare, which provides advice to the Federal Minister of Jobs and Families on Canada-wide early learning and childcare system building. Kirsten Morley is a program officer with the Muttart Foundation, supporting the foundation's work in early learning and childcare. Previously, she was a senior policy analyst with the Government of Alberta, working on childcare policy. She also spent over 6 years working with the Community University Partnership for the Study of Children, Youth, and Families at the University of Alberta, where she had the privilege of working with community-based organizations on research projects related to child development and poverty reduction. It's my pleasure to now pass the screen over to these two to share with us the findings of their work and the recommendations that come out of it.
Great. Well, thanks, Caroline. I appreciate that. And thanks to Laura, who's working in the background to make the technology work. And thanks to all of you who are joining the webinar this evening. Many of you, most of you work in the field of early learning and childcare directly, and I'd like to thank you for your work with children and families. It's profoundly important, and you make a very significant contribution to families' lives and community in the province here. So what Kirsten and I are going to do is to just summarize the findings from the research. We're not going to be able to cover everything, so we'll give you kind of an overview of how the research was undertaken and the major findings. And so I'm going to ask Kirsten. Kirsten's going to start off and talk a little bit about the context for the research and how we actually went about doing the research. Then I'm going to just offer some comments on the major findings. Just draw your attention to the key findings, if you like, because there's a lot of information in the report. And then Kirsten's going to come back at the end and talk about, okay, so given what we found, what do the solutions look like? What do we actually need to do better to address those funding changes? And just to let you know, in terms of the report, it has been shared with the Ministry of Education and Childcare here in Alberta, so it was sent to the Minister and Ministry staff. It's also already been shared and discussed with the Federal Minister, Minister Haidu, who's the Minister of Jobs and Families, and the provincial and the Federal Civil Service have received a copy of it and discussed it. And really, the research, it was a team effort. There was a large working group of people who worked on this, and there was researchers who worked together. So this is really a team effort to address a very important change in public policy. And what I might add was not a very, I don't think, a very good change in public policy in terms of its impact on families. So I'm going to turn it over to Kirsten, who's going to tell you a little bit about the context and how we undertook the research. So thanks, Kirsten.
Thank you, Chris. Thank you, Laura, for transitioning the slide. All right, so before we focus in on what's been happening in Alberta over the past year, we want to just quickly situate this in terms of what's been happening across Canada, because this has been a really transformational time for early learning and childcare in our country. So starting in 2021, the Government of Canada signed federal agreements with each of the 13 provinces and territories around building a Canada-wide system of early learning and childcare. And so these agreements have transferred billions of dollars to each of the provinces and territories, the largest investment in childcare in Canada's history. This has shifted childcare from being primarily delivered through market-based sectors and primarily funded by parent fees to something that is now a publicly funded and managed system, and where government is providing the majority of funding provided to childcare providers. The childcare agreements all center around 4 common pillars. And these are affordability, accessibility, equality, and inclusion. And affordability is really where the provinces and territories have been investing the majority of their efforts, the majority of funding over the past 4 years. And this has meant that we've seen really significant fee reductions for parents as provinces and territories try to move towards that goal of an average of $10 per day fees by March of 2026. And we know some provinces have been successful and others haven't yet. And so this has resulted in really significant savings for parents. But this also means that while we have these 4 common pillars, the provinces and territories are all able to develop their own specific policies to achieve those pillars. So while everyone has moved towards greater affordability, they've all done so in different ways. In Alberta, what we've seen over the past year is that what Alberta has done around affordability has actually moved us away from what the rest of the country is doing. And we're kind of, especially around the elimination of subsidy, we're moving into something that most of the other provinces and territories haven't done. Can we go to the next slide, please? Thank you. So as many will remember, in January of 2025, the Government of Alberta announced some major changes to the way that it funds childcare in our province and to parent fees. These changes were announced in January, and they were implemented on April 1st, 2025, leaving just a few short months between the announcement and when the changes went into effect. And this left providers and parents very little time to adjust to those changes and to what was coming. So there were several major things that happened in Alberta. Prior to April 2025, childcare fees in Alberta cost an average of $15 per day. So this average meant that parents paid different fees for childcare depending on things like their family income, the age of their child, and the program that they were attending. Some families under this model actually paid very little or nothing in childcare fees. On April 1st, the province completely changed this approach. So parents in Alberta now are paying a minimum flat rate fee of $15 per day, and this is equivalent to $326.25 per month for one child in full-time care. And I use the word minimum here because along with implementing this flat rate fee, Alberta has also allowed the continuation of supplemental fees for optional services. And so optional services are things outside of what programs are reasonably expected to provide for childcare. And this can include things like meals and snacks, field trips, and extracurricular activities. And so while programs have essentially always been able to charge for these kind of services, the current climate makes them increasingly problematic. And that's because along with a flat rate fee, in April 2025, the government also changed how it pays the affordability grant of programs. So the government now uses regional benchmarks as a way to allocate affordability funding. Under this approach, some programs now receive less affordability funding than they previously did to cover their costs. And particularly those programs who had higher fees relative to other programs in the region. So these programs are now receiving, oh, sorry, could we go back to the last slide? Thank you. So these programs are now receiving less funding than they did previously, and one of the only ways to make up that lost funding is to charge supplemental fees, which programs are able to charge at their own discretion, and which can be very different across programs. So there's really very little regulation provided around what programs can charge in terms of supplemental fees. And this makes it really difficult for us to know what childcare actually costs in Alberta, because while we have this flat rate fee, programs can charge supplemental fees on top of that fee. And the government of Alberta currently hasn't provided any public reporting on that data. And of course, the last major change that the province implemented on April 1st, 2025 is the elimination of the childcare subsidy program for children 0 to kindergarten age. And we'll discuss that in the next slide. Laura, thank you. So before April 1st, Alberta used the childcare subsidy program to reduce childcare fees for families in Alberta. So the subsidy program paid a set amount to the childcare program on behalf of families depending on the family's income. And under the previous approach, as I mentioned, families in Alberta could pay different amounts for childcare, and some actually paid very little or nothing in childcare fees. And so the infographic on the right hand here is trying to explain how this was possible and how this worked. So if we look at this example, let's consider a family who has one infant in full-time care, a household income less than $120,000 a year. So prior to April 1st, 2025, the way that we determine this family's fees is by taking the monthly cost of their childcare program, subtracting the subsidy amount, and subtracting the affordability grant amount. So subsidy was paid depending on the family's household income, and the affordability grant was paid for each child regardless of income, but there was separate amounts for different ages of children. So in this example, we have a family attending a program that costs $1,000 a month. They receive a $266 subsidy because their household income is less than $120,000 a year. And they receive the affordability grant in the amount for an infant, which is $883. So if we take the amount of subsidy and the affordability grant together, that's greater than the monthly fee of their program. So in this case, the government actually covers the entire cost of the childcare program, and this family pays nothing in childcare fee. After April 1st, this same family now pays $326.25 plus any supplemental fees that they've opted into. So for families who paid very little or nothing in childcare fees, this new flat rate fee is actually a very significant increase. And this increase is especially significant for those families who had multiple children in care. So if this family had 2 children in childcare, their fee could be over $650 a month, and that's a very large increase if they had previously been paying nothing. The new rates are actually also, they can be prohibitive for those who are entering the childcare system. So they're not only an increase for those who are previously in regulated childcare, but they can be enough of a barrier that a family who wasn't previously accessing childcare now can no longer enter the regulated childcare system. The province has advised that families who are on very low incomes can access the income support program for assistance with childcare fees, but this is really only available for those with extremely low incomes. So without the childcare subsidy, we still have a very large gap of families whose needs are unaddressed. And with the elimination of the childcare subsidy, Alberta is now one of only 4 Canadian provinces and territories that has no subsidy program to reduce childcare fees for lower income families. So in most provinces and territories, all families are receiving lower childcare fees, but there's also targeted supports to further reduce fees for lower income families and ensure that access is equitable rather than just equal. Can we go to the next slide, please? Thank you. All right, so research shows that children from lower income families tend to have lower participation in childcare than those from higher income families. And this, throughout Canada's history, this is not a surprising finding. Childcare fees have been incredibly expensive in this country, potentially upwards of $1,000 a month. So in that context, it very much makes sense that lower income families would access childcare at lower rates. But even as we now in Alberta have these significantly lower fees than we did 4 years ago, we're still likely to see this trend where lower income families are excluded from regulated childcare continue. And that's because while Alberta has made childcare fees the same, equal, they're not equitable. So the flat rate of $326.25 plus any supplemental fees means different things to families who have different income levels. And so we're likely to see that exclusion continue. We also know that children and families who are facing economic barriers are those who are most likely to benefit from high quality early learning and childcare. So by excluding those families, we're excluding those who might get the greatest benefits from it. Economic insecurity in childhood is associated with a range of negative developmental outcomes, but high quality childcare has been shown to reduce that impact. Childcare also often serves as a really important access point for families to access things like speech language supports, early intervention supports, and inclusion supports. Childcare being unaffordable also has very real and practical impacts for families. In many cases, the need for childcare doesn't just go away when it's unaffordable, but families find themselves trying to piece together help from friends, family members, and neighbors to fill this gap. And when parents aren't able to cobble together those alternate childcare arrangements, we can see parents, and especially mothers, forced to reduce their work hours or to leave the workforce altogether. And for those lower income families who do try to remain in in regulated childcare and take on those fees that can make up a significant portion of their incomes, this creates an additional financial burden. Many of these households are already stressed under the increasing cost of basic necessities like food and housing and transportation. Can we go to the next slide, please, Laura? So this is what we are really concerned about in Alberta with the recent affordability funding changes. And this is what the study that the Muttart Foundation, AECEA, and the Alberta Leaders Caucus were trying to understand. So how have lower income families been affected by the policy changes implemented by the Alberta government on April 1st, 2025? So in response to those changes, we conducted a rapid research study. We conducted our data between mid-March and the beginning of May 2025, just as those changes were beginning to go into effect. And the research included several different types of data. So first were interviews with 23 senior staff from childcare programs, representing 33 centers and serving about 2,000 children, as well as 4 family day home agencies, serving about 1,900 children. We also conducted interviews with 20 lower income families who are accessing childcare. And we also conducted some secondary data analysis on national data regarding participation in childcare. And finally, a focus group discussion with staff from community organizations working with newcomer and immigrant families. And with that, I will pass it on to Chris to discuss the findings.
Great. Thanks, Kirsten. So I'm going to give you a summary of the findings. Again, a little bit of high level because there's a lot of different areas that we explored. And so I'll just kind of share with you what the research found in terms of how the changes were impacting on lower income children and their families. And so first of all, I'm going to tell you what the service providers told us. What was their sense of how the changes impacted on the families that they served? And if you look at that first bullet, 33 different centers, across those centers, parent paid fees for all of the lower income families increased in 25 of the 33 centers. So all of the families who are accessing licensed regulated childcare across those 25 centers, all of those families, their family paid fees went up. On average, the fees increased. You can see the numbers there. So for infants, it's $245. For toddlers, $195, $140 for preschoolers, and $290 for kindergarten students. So all of the families in 25 of the 33 centers, their fees increased. I haven't got the figure on there for family day home, so I apologize to you for that. But similarly, in 2 of the family day home agencies, all of the family day home providers, the services that they provided for children and families, their fees went up as well. So every lower income family in 2 of the family day home agencies saw those fee increases. If you look at the third bullet, how much did they go up? Well, at 18 of the 33 centers, some or all of the lower income families who were accessing services, their fees increased by the maximum amount, the $326.25, when that new flat fee was introduced. So in 18 of the 33 centers, families saw that maximum increase. So what that means, as Kirsten was saying, it means that those families prior to April 1 were essentially paying 0 parent paid fee. And as of April 1, their parent paid fees went up to $326. And again, same in the family day home agencies. In 2 of the family day home agencies, families also saw their increase in fees of $326.25. And what we don't have on there, we don't have anything about supplemental fees, because the centers that we worked with, the 33 centers and the 4 family day home agencies, in most cases, those programs were not looking at introducing additional supplemental fees. There were some fees, mainly for nutrition, but there were very modest fees. So essentially, if you ask what the increase is from the standpoint of the service providers, it's significant increases fees for families, and it's a significant numbers of families whose fees increase. So can I get the next slide, please, Lauren? So what happened? What did service providers see happen as a result of these fee increases? Well, the lower income families in 14 of the 33 centers, the lower income families withdrew. 14 centers had lower income families leave the program right away. Now, in most cases, it was a small number of families, between 1 and 5 families at individual centers. But in one particular center that was serving 4 sites, serving lower income families, they had 40 different families withdrew. So across the centers, families withdrew. And think about that timing for withdrawing a family from early learning childcare. Families generally don't withdraw on April 1. That's partway through the school year. So families withdrew in 14 of the 33 centers. Their families left. And which were the families who left? And as Kirsten indicated, it was families who had multiple children in childcare, faced very significant increases. Those dealing with their own sort of financial challenges around job loss or changes in employment. But essentially, families left childcare right away. And where did they go? How did the changes impact families? We did the research at a time when we were actually still trying to fully understand the nature of impacts. And families themselves are also trying to understand the nature of impacts. But essentially, families left April 1 when those changes came in place. What we did see a small number of centers said, we're going to try to cover the increase in fees for lower income families, and we're going to try to do that for a period of time. So 3 of the centers actually looked at ways that they could perhaps try to cover those fee increases for a period of time. One center said, we're going to try to cover existing families till September, for instance. Can we get through to September? So families faced withdrawal, and centers try to respond to that. At 18 of the centers, what was interesting is at 18 of the centers, families said, hey, can we move to part-time care? We're facing an increase to $326.25, so can we move to that part-time care fee, a cost of around $230 a month? And while 18 centers finally made that request, it was only 3 centers that said, yes, we're going to be able to provide you with part-time care. So essentially, centers were unable to respond to the changing financial environment for families. So can I have the next slide, please, Lauren? So what did service providers tell us about the changes that they saw taking place? And so if you look at the first quote, two things stand out there. So they were given just 2 months to figure out their whole budget. So families had 2 months to try to think through the change. And they went from paying 87 to 326. Now that's hard math. I couldn't do that. So that's a $240 increase. So two things stand out there: the size of the increase, $240, and the timeline for the increase, so 2 months. So very important changes there. What directors also said is that they felt as though families did not understand the changes that were going to take place on April 1. So as the changes were announced, it was essentially left to centers and family donor agencies to try to support families in understanding what the changes meant for them. Families heard some of the public communications which said fees are going down, people are going to be paying less, and so they assumed that they would be paying less. What they didn't understand fully was that the subsidy was disappearing. So centers and family day home agencies were very concerned at the end of March and beginning into April that families would not actually understand the changes that were going to take effect. And this was particularly interesting for families who had children in out of school care and still received subsidy. Families were struggling, saying, well, hang on, the subsidy is going in 0 to 6, but it's staying in out of school care. So this was a time of confusion for families. What service providers also said, and I think this is profoundly important, is that the lower income families that they were serving, they had very few alternative childcare options available to them. So if they were facing having to withdraw from regulated family childcare, whether center-based or family childcare, families had very few options available to them. It wasn't that they had choices that they could move into. And then on the final point, it seemed to be, as what the center director said, it's the lowest income families who are going to be hit the hardest by these changes. These are the families who are going to use their words. These are the families who are going to disappear from childcare. And when we asked them, remember, we're asking them at the end of March and then at the beginning of April, what's happening? So 14 centers said families have left and leaving. We also asked them, what do you think is going to happen as we proceed through the school year into the summer and into the fall? And 13 centers said, we're going to lose other families. We're essentially going to see low-income families disappear from early learning and childcare as a result of these changes. And here's something to think about. What center directors also raised with us is that some of those lower income families, they're actually ECEs. They're actually early childhood educators who are working in the field, who previously received a subsidy, and they're going to face significant challenges remaining in childcare. And 11 of the centers actually originally provided benefits to their own staff to allow them to reduce their childcare fees. And they were saying, we might not be able to do that going forward. So service providers are saying this is going to result in a change in the families who are accessing regulated childcare, and essentially it's going to be the lowest income families who are squeezed out. So can I get the next slide, please, Laura? So what did the lower income families tell us? So just as we spoke to center directors and family day home agency staff, we asked them, can you help us talk to some of the families in your centers and your family day home agencies who are facing these increases? And thank you to them for doing this. This was not easy. And thank you for the families also who are stepping forward and saying, hey, yeah, I'm willing to be interviewed about how these changes are affecting me. And what you see here, you see a kind of list of numbers. We see that we spoke to 9 single parent families and 11 two-parent families. But what you're essentially seeing, there's 20 stories here. There's 20 stories for families about how early learning and childcare was part of their lives, and now it was becoming more difficult for them to access those services. And if you look at the incomes figures there, as Kirsten said, if you look on the left-hand side of the chart, what you will see is that prior to these funding changes, families with what we would consider to be very low incomes were accessing childcare in Alberta. So the single parents and the two-parent families with incomes of less than $50,000, they were able to access childcare as a result of those fee reductions. And so what we've seen as a result of those changes is those families will not be able to access early learning and childcare going forward. And just to tell you something about those 20 families, 10 of those families had 1 child in childcare, 10 had multiple children in childcare, but some of those families also had school-aged children as well. So these were very complex families who prior to April 1 were able to access childcare, and after April 1 were facing a very different environment. So can I get the next slide, please, Laura? So what did families tell us about the fee changes, how that was impacting on them? So 18 of the 20 families said our fees are going up. As a result of the funding changes, our fees are going up. Remember, these are not just numbers. These are families' lives and stories. The average increase for the families we interviewed was 227 for families with one child in childcare and 478 for families with more than one child. And again, if you look at the top bar chart, what you see is the fees that these families were paying prior to April 1. So if you look, there's 3 families who were paying no fee for regulated childcare, 9 were paying $1 to $100. So these families, they face very significant fee increases within a matter of 2 months. So think of those 3 families who are that 0 fee. They are then going from paying a 0 fee to a fee of $326 a month, and potentially also supplemental fees. So can I get the next slide, please, Laura? So how did the families respond? And this is the thing that this is the really important things to reflect on. So essentially, of the 20 families, all but one of them said, we're going to try and stay in childcare. We're actually going to try and stay in regulated childcare. There was one family that withdrew. The family that withdrew was a single parent with 1 child in childcare and 2 older school-age children. Her family was facing a fee increase of $190 a month. And this single parent, her main source of income was student loans. She was going back to school to continue her education. So she withdrew right away. And when she withdrew in the interview with us and our research, she said, and by the way, I'm hoping to go back in the fall if I'm managing to save enough money and cover these costs. So one family withdrew right away. 8 families, 8 out of 20. So we were asking them right at the end of March into the beginning of May. 8 of the families said, we're very concerned that we're going to have to withdraw in the coming months. We're going to try to get through to summer, which is often a general cutoff in early learning childcare. We're going to try to get through summer, but we're not sure we're going to make it. So 8 of the families said, we are very worried that we're going to have to withdraw our children. But for all of the families that we interviewed, withdrawing their child from childcare, that was reviewed as the last resort. So we hear lots of good things and we read lots of good things of what high quality early learning and childcare can do for children and families. But it has to be high quality early learning childcare that's affordable. And so these families were saying, we don't want to withdraw. This would be our final resort. Childcare was foundational to their family well-being, foundational to their children's development, and foundational to their participation in the workforce. Those families that were looking at withdrawing, they basically said, there's very few options out there for us. So the families who were thinking about withdrawing, 9 of the families were saying, maybe we'll go to part-time care. Maybe we can find part-time regulated care. Of those 9 families, only 3 found a part-time care option that might work for them. So very significant challenges for families, not able to find alternative choices. 15 of the 18 families were very concerned that they were going to be unable to continue financially to pay for the childcare. And most of them, 15 of them, said their family finances were already particularly straitened or constrained or challenged prior to the funding changes. So if we can get the next slide, please, Lauren. So what did families say? So these are the quotes from the families. First one, I was never really hitting my fees on time anyways. I was struggling month to month, even with a subsidy. Now I always felt like I was behind. That's from an early child educator. That early child educator's fees were essentially staying the same, but you can see that she was struggling financially beforehand. Second one, the hardest thing about the rate increase was how little time and notice everyone got to try to scrape things together. So a change in that nature in the families, think of the average fee, $227 increase for one child, $447 for 2. That takes time to plan and arrange your finances around that kind of change. So they didn't have that time. Third quote, there's so many financial changes to childcare. It's been like a roller coaster. So what families were saying is essentially fee reductions over time have provided some sense of reduction in terms of costs, but there's no stability. They were relying, the families who signed up for childcare in the 2024-25 year were relying on those fees staying constant throughout that year. They did not expect a change on April 1. So very significant challenge for them. And then finally, and this is a point I'll speak to a little bit more, for both children, it will be almost $700 a month. That's why if I pay the daycare, I pay the rent, I'm done. So as part of the interviews, we asked families, and in a very respectful way, we asked them what their household expenses look like. And I think we've all heard about affordability challenges relating to housing, food, transportation. And a very significant portion of these families paid way more than 30 to 40% of their pre-tax or their after-tax income, on housing. 5 of the families were paying more than 50% of their after-tax household incomes on housing. So what these families were basically saying is that we don't have any discretionary income. We don't have any. So when we ask them what they're going to do, the things that they proposed is they're going to cut out their children's extracurricular activities. Or in the case of 5 of the families, they say we're probably going to be looking at changing how we buy groceries. So the financial burden that was shifted onto these families within a very short period of time was disproportionately difficult. And it was disproportionately difficult for those families with the lowest income. So can I get the next slide, please? So we know from the centers that we interviewed, and we know from the families that we interviewed, that these changes were significant in terms of the amount of increase and the amount of families that we talked to in the centers that we talked to. But what we wanted to do was find out, say, okay, so we had a sample of centers, we had a sample of families. How many families potentially across the province were impacted by these changes? So to do that, what we had to do is we had to go and look at a Canadian survey on early learning and childcare research, which tells you nationally how many children are in regulated licensed childcare across the country, and it also tells you about their family income. So we pulled from that database how many families in Alberta would have lower incomes, and I'll tell you what we mean by lower income, and how many would then face affordability challenges. So what we actually, unfortunately, the provincial government had that data. They had that data on the number of families who were receiving subsidy on the lowest income, but they weren't able to share that data. So we had to regenerate that data. So how did we define lower income? So there is a number of ways of defining lower income in terms of economic research. And so what we did, we took the 2 measures that are considered to be measures of poverty or low income. One's called the market basket measure, and the second's called the low income cutoff. And we said, well, that's poverty. We're interested in families that are slightly above poverty. And so we added a supplement in, a inflated margin in to cover low incomes. And what we determined is that families who had a pre-tax income of $80,000 were probably falling into that category that we could consider lower income. So then the question was, well, how many of those families are there? So if I can get the next slide, please. So if we use low income cutoff $80,000, in 2023, there were 30,000 children who were accessing regulated licensed childcare center-based and family day home in Alberta, whose families had a pre-tax income of $80,000 or less. So all of those families, all of those 30,000 children and their families, they would be eligible for that $266 subsidy that Kirsten mentioned. And effectively, as of April 1, all of those 30,000 children and their families, they lost that subsidy. That subsidy was removed. So 30,000 children were living in families with lower incomes, accessing childcare in 2023, who, as of April 1, lost their subsidy. So the majority of those families, based on the way the current system was set up prior to April 1 and then after April 1, the majority of those families would have seen their parent fees increase. Now, again, we don't know the exact amount because, as Kirsten said, prior to April 1, we used a very unusual model. We had the parent charge fees, which came out of the market system, which we then deducted the subsidy from, and we then deducted the affordability grant. And what we know is in those programs that served perhaps higher income families, maybe in communities like Calgary, where fees were higher heading into Canada-wide, some of those families, their fees wouldn't have gone up by $326. But for most regions across the province, families who had an income of $80,000 and then lost their subsidy, their fees would have gone up. So very significant increase. And then what we also did, we said we've got that measure of, can I get the next slide, please? Okay, we've got that measure, so we know there's about 30,000 families who are affected. So how about we look at what the new fee means in terms of childcare affordability for families? So how do we estimate whether a family can afford to pay childcare fees? And what we have in the research kind of environment, we have something called the Family Income Affordability Measure, and that's been calculated based on historic data. And what that Family Income Affordability Measure says, that if a family is paying more than 10% of its after-tax income on childcare, then that childcare is unaffordable. So what that gives you a benchmark. Okay, now obviously it's a broad benchmark, but it gives you a sense that if families are paying more than 10% of their after-tax income on childcare, then they can't really afford to spend that money. Again, think of what I said about the major costs. If you're spending 50% of your after-tax income on housing, and you're spending 30% on food, and you're spending 10, 15 on transportation, you don't have 10% of your after-tax income to spend on childcare, so you need something left. So when we use that measure, and then we took the new flat fee, $326.25, and then we added in a supplemental fee, $100 a month, we know that that's more than some centers are charging. It's significantly less than others are charging. When we add those two together and we say, how is childcare affordable for families who are paying $426.25? What we find is that for single parents and two-parent families with one child in childcare, if they have a pre-tax household income of less than $50,000, they can no longer afford to access childcare. And again, think back on that slide we showed you about the families with very low incomes. Prior to April 1, they could. Now, families with pre-tax incomes of less than $50,000, childcare in Alberta is not affordable for that family. What about the families with two children? When I was in childcare with our kids, most families had two children in childcare. You had a toddler and a preschooler or infant. So for those families now that have two children in childcare, those families that have household incomes that are less than $100,000, they cannot afford childcare. It's no longer affordable, with them. So essentially, what we now have in Alberta as a result of the changes, we have regulated childcare that is effectively unaffordable for almost all the lower income families in the province with two children. And I think that's kind of striking, particularly when, as part of the Canada-wide system building work that's now been going on for 3 or 4 years, one of the major goals of the Alberta government that it announced again in February of 2025, and it reiterated again over the summer, one of the major goals of the Alberta government was to make sure that childcare was most affordable for those families with the lowest incomes. So effectively, that's not the case. So I'm going to turn it back to Kirsten, who's going to tell you, okay, so what do we do? How do we fix this? So thanks, Kirsten.
Thanks, Chris. Yeah, so what can we do? If there's one thing we could recommend to the provincial government to address this, it's to implement a revised childcare subsidy. So removing the subsidy was a policy choice, but it's also something that we can fix. And Alberta's commitments under the Canada-wide agreement, as well as what Alberta has publicly said in some of its communications to the sector, are very much in alignment with bringing back a childcare subsidy. So as Chris mentioned, under the Canada-wide federal agreement, Alberta has committed to delivering childcare with consideration for those more in need. Alberta has also publicly communicated to the sector saying that Alberta wants to ensure that childcare is most affordable for Alberta's lowest income families. So these things are very much in alignment with bringing back a childcare subsidy. We also need to recognize that we don't necessarily need to choose between an approach that makes childcare affordable for the majority of families and a targeted subsidy that reduces childcare fees for our lowest income families. This is kind of a false choice. We could have set or capped fees that reduce fees for all parents, while also having a childcare subsidy that further reduces fees below that set or capped fee for our lowest income families. And in fact, in most other provinces and territories that do have a flat fee approach, as Alberta does now, they also have a childcare subsidy. And can we go to the next slide, please, Laura? And so, of course, bringing back the childcare subsidy a revised childcare subsidy is the number one thing we really want to emphasize. But there's also some complementary strategies to look at along with that. So one of these things, we mentioned several times in this presentation that the 2-month period between announcing these very significant changes and then implementing them it's not fair. It was too short of a time period for families and providers to be able to adjust to that. So really ensuring stakeholder engagement in a meaningful way and giving advance notice of future funding changes is really important. There's also some pretty major things the province could do around data collection and public reporting. So as Chris mentioned, the province hasn't released information on the number of families who are accessing subsidy, and we kind of had to piece that together. But they could publicly collect and report on children from lower income families and their participation in regulated childcare. And this would give us really high quality data that would allow us to understand the impacts of these kind of policy changes on how lower income families are accessing childcare. And so we could see into the future, are these families now being excluded under this model? And is this something that really needs to change? The second big data collection and reporting action that can be taken is around supplemental fees. So again, as I mentioned, the province currently isn't publicly reporting on supplemental fee data. So we really don't know the number of providers who are charging supplemental fees. We don't necessarily know what they are charging supplemental fees for, the amount of fees, and the number of families who are opting into these fees. So we know that there's this flat rate, $326.25, but we don't know how many families are paying additional costs on top of that for these supplemental fees for optional services. And so this really obscures our understanding of what childcare really costs in Alberta. And it doesn't allow us to make good conclusions about what affordability in our province looks like. And I think there was one more thing just to hit home there. Thank you, Laura, was that we can review the grant funding for service providers. As I mentioned, the grant funding model changed. It's now based on historic fees and regional benchmarks, and it doesn't provide additional allocations for any additional services for children who might have additional inclusion needs or different kind of complex needs. So that's something that the province can look at going forward. Thank you so much. And with that, we can go to the last slide. Thank you, Laura. All right, thank you again, everyone, for joining us today. Thank you to AECEA for bringing us all together for this conversation. And I believe now Laura has been monitoring the chat and will convey some of your questions. And if people have additional questions, they can continue to add those in.
Yeah, thank you, Kirsten. Thank the both of you for the presentation there. There's some sobering stats in there and everything, and a lot of work that still needs to be done, I think. I'm not seeing a lot in the chat. I do have one question, though, from Bernice. She's saying, when looking at supplemental fees, would the ideal be that the province include nutrition into affordability rates and into regional rates, or that it be considered the overall cost and the parents assessed for a subsidy to support overall cost based on their income needs?
So that's a good question, Vanessa. And so it's kind of interesting when you look at supplemental fees. So it's often useful to compare to other jurisdictions, right? And I think one of the reasons that something can be a supplemental fee is it's not included in the regulation or requirements in Alberta. So I think when we talked to the service providers, they were absolutely clear that nutrition is an essential part of a high quality early learning and childcare program. It's foundational to the quality of that program. It's foundational to the care and the support of the children. So I think what I would argue, Vanessa, I think it's probably time in Alberta to say that nutrition is an integral part of an early learning childcare program. We don't have to specify how that nutrition is provided. We can't imagine that every early learning and childcare center will have a fully serviced kitchen, for instance. But I think what we need to think about is nutrition is a fundamental and critical element of a high quality program. And so why don't we include that within the standard base set fee? More broadly, Bernice, I would say I think supplemental fees are something that we should view with extreme caution. supplemental fees, and this has been now, the idea has been flowing around for a couple of years as part of the cost control framework. But supplemental fees introduce the notion that we can have different levels or different tiers of services that families are able to access on behalf of their children. And it puts service providers, it puts frontline educators in a terribly difficult position. Would we, for instance, within a center-based environment where we have 16 preschoolers in a room, would we say 12 preschoolers are going to participate in the activity and 4 preschoolers aren't because their parents are not able to pay for that activity? If that activity is central to the well-being and the support and delivery of a high-quality program, that activity should be available to all children. So I think we have to be very careful in terms of how we think about supplemental fees. What is the goal and purpose of supplemental fees? Because I think it's fairly easy to imagine that supplemental fees will present a barrier economically for children's participation in early learning and childcare. And I don't think that's the way we want to go. So maybe very minor supplemental fees, but not supplemental fees that result in children being excluded from practices. That's not what service providers want. That's not what educators want. And that's not what children deserve. So I think in supplemental fees, we need to give a serious rethink as to what is, because what is the policy goal? What are we trying to achieve here? Are we trying to lower costs for somebody? And how are we trying to do that? I think there's better ways of lowering costs than transferring it onto individual centers to transfer it onto individual families. So thanks for the question, Vanessa.
Okay, got another question here from Ainsley. The government has recently stated that they are dedicated to protecting children. Can you give any insight into how the ministry's removal of subsidy for Alberta's most vulnerable children align with their commitment to children's safety and well-being?
Yeah, I think the simple answer, Ainsley, is it doesn't. And I think, as Kirsten said, when you're looking at policy change, this has been an environment in very significant and dramatic change. I don't need to tell that to you as operators and service providers. We've gone through various iterations of funding models. We've gone through various ways of trying to expand the services. And I think what this is, this was a policy oversight. If you like, this was a mistake. This was a policy decision that was made that wasn't really well considered and has resulted in some really poor outcomes for children and families. And so, as Kirsten said at the beginning, there's a very significant and extensive literature that says that those children who are actually going to benefit the most from high quality early learning childcare are those children who are perhaps the most vulnerable or the most marginalized or whose families are facing additional difficulties. So I think, Ainsley, this decision does not align with this. And as Kirsten and I both said, it also doesn't align with what the Alberta government has said personally and politically is its goal. Its goal is to make early learning childcare most affordable for those families with the lowest incomes. And so this, I think this needs to be addressed. This is a very significant oversight. The service providers we spoke to, Ainsley, they were hurt by this personally. They had families who the educators had strong connections with. They had families who they saw were benefiting profoundly from being in a high quality program. And those families were now being excluded. So I think this was a policy decision that needs to be reversed, needs to be changed. And as Kirsten said, it's not a complex fix. It's an expensive fix. I'm not saying it's not expensive. So the previous subsidy program, the estimate from the Jobs and Families, or Jobs, Economy and Trade, Ministry in 2024-25 was that program cost $197 million. Now, I think what I would argue is that subsidy level going up to 180,000 was probably too high. So you probably need to change that subsidy approach, but that's the kind of fix that's needed. And it's not a complex fix. As Kirsten said, if you go across the country, look at other jurisdictions, Alberta is now an outlier in how it's reducing the fee of childcare for those families with the lowest income. So we have to fix it. So short answer, I don't think it does align. So let's make it align. Let's work together on this.
I would love for everything to be that easy, where we say just make it align. There is another question from Nitu saying if the province is in talks with the federal government to make childcare affordable for lower income families? Do we have an estimate about the timeline for when we can see another change in the affordability policies?
Okay, at the moment we don't. We do know there was a media release came out this afternoon that said the Alberta and federal governments will announce their new agreement in respect to Canada-wide system building tomorrow afternoon in Calgary. So that's the first time that we will have a chance to hear how the governments are going to work together to advance learning and childcare. And I would say whatever is announced tomorrow afternoon, it's contingent upon all of us to share our insights and observations with the Alberta government and say, you know, there's evidence, strong evidence that this is a better way of approaching things in terms of a policy, in terms of supporting lower income families with reduced fees. So we'll get the announcement tomorrow afternoon, and then after then we'll see, okay, how do we move forward and address this challenge that's arisen in Alberta. And to go back to what Kirsten said, I mean, for families, since the start of Canada-wide system building, 70% of the federal money, $3.8 billion, 70%, I can't do that math, but so 70% of that funding was allocated to reduce parent fees. And let's be absolutely clear, the reductions that took place in families' fees were very significant and very important for families. Families, as Kirsten said, prior to 2021, many families could not access early learning childcare. It was not affordable. And again, think back to that chart we told you. The families in our sort of small sample, families with lower incomes were able to access early learning and childcare prior to April 1. So let's go back and let's make sure they can access early learning childcare after the announcement tomorrow, whatever tomorrow's date is, December the 12th, right? So let's fix it, okay? Let's make it right for children and families, okay?
Thanks, Chris. Another question from Molly saying, is there anything you would recommend educators, programs, parents, or others in the sector can do to advocate for improvements to the affordability funding?
Yeah, really good question, Molly. And I think this is the way, you know, policy, how do you develop policy? Well, I think what I would argue with Canada-wide system building, one of the challenges we've encountered is we haven't listened to a lot of voices from the stakeholder community about how we deliver early learning childcare. And one of the voices we haven't listened to is frontline educators. Frontline educators interact with the children and families on a daily basis. And so I think what we need to do, we need to bring forward the arguments. And so that's everything, Molly, from phoning your MLA. So one of the families in the sample, one of the families had relocated from Ontario to Alberta with 3 children. They were in a center in the south, I think it was the southeast part of the province. They were paying little or no fee prior to April 1. And then suddenly, after April 1, they were paying $975, whatever it was. And so that mum, she got on the phone and she phoned her MLA and she said, hey, do you realize that my fees have gone up, you know, close to $1,000 a month with 2 months notice? And her MLA said, I didn't actually know that. I did not know that had happened. So I think it's really important to discuss the changes with MLAs, discuss the changes with other sector stakeholders and say, you know what, this is not working for children and families. For the children and families that we serve, this is not working. And I go back to the point I made earlier. Let's not forget that unfortunately, amongst the lower income families who lost that subsidy, or early child educators. So if we want early child educators to continue to stay in the field, to support the growth and development of children, are we going to tell them that they can't have their own children in childcare because they can no longer afford it? So I think we have to bring forward reasonable, principled arguments. And we have to say, you know what, this is the right thing to do. And there's evidence to support it. Yeah, there's a cost to it. But there's a cost to not doing it. And one of the things that the service providers talked about in the families themselves is that, and I think you saw it on one of Kirsten's slides, is that when a child who perhaps has additional needs in early learning and childcare, it's that early learning and childcare, the frontline staff, the program, who first identifies those needs, whether it's a speech language delay, whether it's a developmental delay, whether it's a behavioral challenge, that's where it's first identified. Now, if that isn't identified, and then that child grows up 2 or 3 years and then goes into the school system, we've missed an incredibly important period to work with that child and family to help them access the services that they need. So, yeah, there's a cost for doing this, and there's a cost for not doing it. There's also a cost for not doing it if single parents and two-parent families aren't able to participate in the labor market. There's a cost for doing that. So there's always costs. So thanks for the question, Mo.
I think we're at our end of time now. So thank you everybody for attending today. I'll drop ACE's email in the chat, and if you have any questions that come up, you can always send them our way, and then we can field them to Chris or Kirsten or whoever is on the team, and we can kind of go from there and try to help you with your question. If we did not get to your question in this round, then we'll reach out to you via email afterwards. So thank you very much for attending, and thank you, Kirsten and Christopher, again. That was fantastic.